Okay, this is January 10th. We're here with Toby. Toby, do I have your permission to take a video?
Yes, sir.
Thank you. May I see you get out of that chair?
I have to do it slow, or
It looks to me like you're very cautious with getting up and down.
I've learned to be the hard way.
Okay, and for the viewer, if you told me that this morning your pain level was 10, you saw someone and it's come down to 2 right now. But what I'm going to ask you to do is just mentally note how severe your pain is at this moment, or what you walked into the door with, and we're going to call that a 10. How far you can get. That's good enough. That's good enough. Yeah, I just asked you to lay down and you told me this is where you have trouble. So let's see what you can do here.
It's turning over, and these sideline deals are. On my back, you said, right?
Yep.
Now this is where sometimes I get a shot. Okay, this time I made it. Okay.
Toby, we just shot the second tooth. Can you sit up, please?
This way or sideways?
Just get up, facing me.
I might have to.
Don't be afraid. Just do it.
Oh, that was better.
Yeah.
Wow.
Say that again.
Jeez Louise.
Okay.
Better.
That, yeah.
Toby, lay back down, please. Don't be afraid. Just do it. Oh, my.
Yeah, that was better.
There's no question about it. Is that correct? I mean, you do. Okay. Now, please sit up again on your own. All right. Now, hang on. I'm going to ask you to get up and walk out the door again.
That was faster.
Turn around and please come back. Mrs. Toby, what did you notice and what did you say?
It was faster, and he wasn't as careful. He just,
Smoother.
yeah, smoother.
Do you agree?
Yeah, very smooth.
Okay.
Fast. Robert?
Mr. Toby, we're going to check your range of motion again. Let me see you bend over and try to touch your toes.
That's better.
Okay. Did you notice a significant difference?
Yes,
No question about it.
quite significant.
Quite significant. Okay. And Toby, you're agreeing there was a very significant difference. Is that correct?
Yeah, at the end there, yes.
At the end. Do you have any pain in your back right now?
No?
No. Okay. So if I asked you to consider your pain when you walked in the door at 10, so we could get an idea of reduction. You've gone to 0. There's no pain, and I didn't touch your back. I didn't put a needle in your back.
Right.
I touched your teeth. For your understanding, each tooth in your mouth is connected to an acupuncture meridian. And my chart is right behind you, where it says empirical relationships between odontomas and organs and disease. The first tooth I did was tooth number 12, which is a bicuspid. That tooth is related to the lung large intestine meridian, which deals with the L4, L5 area in your lower back. The second tooth I did, which was the incisor, which wrapped it up, is connected to the kidney bladder meridian. The bladder meridian runs right down the center of your back. I like to avoid sticking long needles into people if I can help it, even though I make a good living that way. If I can avoid sticking you with Prolo or prolozone, I'm going to do that. And where there's root canals, I look for teeth first. You tested positive on my evaluation, and I wanted to check your teeth and then see what happened to your pain and range of motion, and you got what I would call a dramatic result. Your pain went away. And except for fear, you were getting up and down off of that table rather easily. Agreed?
Yeah, lastly.
You just saw him lay down again.
Yes.
What are your thoughts of what you just saw?
The difference was amazing.
He laid down
He laid
without
down
any difficulty, correct?
quickly and no pain.
Mrs. Toby, would you agree?
Yes.
Sit on the table.
Sit on it.
And would you lay down, please, just like you did before? Flat on your back, face up.
Yeah, it's a lot easier.
Would you say that again?
I said that's a lot easier.
Okay. Are you pleased, I hope?
Oh yeah,
Okay.
hands down.
Hands down. Mr. Toby, how did that compare with prolotherapy?
Oh, much easier. Boy, prolotherapy is rough.
And how are the results compared to prolotherapy?
Well, at this point, I'm feeling fine. In the morning and the next morning is what I'm looking to.
Well, we don't know yet, and that's what I tell
Well, no,
people.
we got to wait and see. But right
Of
now,
course.
I'm happy.
Okay.
More so than I'm just pleased that you went ahead to do that because
You're welcome.
I'm pretty, as I said, desperate.
Say that again.
I'm looking forward to the next couple of days, and I will be this man's booster for sure.
Okay. And I may post this on YouTube?
Yes.
What was that you said?
I said, is it showtime again?
You know, you look a little different now than when you did a couple hours ago.
I feel considerably different, and it was 4 hours ago
It was 4 hours
when I
ago.
got here, yeah. And
You
I
did-
was miserable,
waited for an hour.
and have been all day until then, so I,
When you came in here, you were feeling pretty decrepit, yes? And now you've actually got a smile on your face.
absolutely, yeah, and no pain at this point, so
No pain at this point, and it's now it's about 2 hours since I last treated you locally, correct?
so all that pain stuff is supposed to have gone away, so now I'm real.
Yes. The
Okay.
local anesthetic is gone and out of your body.
Wonderful, then I'm happy to have made the trip, I'll tell you, because this morning I was not in any shape to go anywhere.
Can I see you stand up, please?
Yeah, that's better too, isn't it?
That was quite better, all right?
After I've been sitting for an hour.
Okay, let's see you how you do on the table. And may I see you get up now, sir, please?
Boy, this
Do you have any comments for me?
I'd say terrific. I was, for the pain that I've gone through with that sometimes. I mean, I don't scream often, but there's been a few times in the last 3 weeks, literally, I would scream because the pain of when I would get up like that just about cut me in half. So-
Is this something you would recommend to other people?
I would recommend Dr. Rowan for sure. Because I've been through prolotherapy and the pain that goes with that, although it worked, apparently other things have.
Comments, daughter Toby?
Yes, phenomenal. He's a new man. This morning he could barely move, walk, and now he's getting up and down, walking back and forth, and smiling instead of groaning.
I asked you before, if you hadn't have seen this, would you have believed it if you heard about it?
You know, it is just very amazing. Probably not. Probably wouldn't believe it.